Dr. Omer Awan, who's a senior public health contributor for Forbes and a columnist MedPage today. He joins me from Baltimore, Maryland. Dr. Awan, thank you so much for taking the time. I know you've been listening in on this hearing as well. Full disclosure, I believe you've been highly critical of Robert F. Kennedy's junior appointment to head HHS in the past. I'm wondering, given what you've heard from him today, walking back some of his previous comments and skepticism about vaccines, saying point blank that he is not anti-vaccine, if any of your previous views have changed about his fitness for leading such a huge organization.
Well, they haven't changed beyond it. And the reason why is I think we have to evaluate him based on what he's done over the last several years and what he has said over the last several years and decades. And he has continuously said that vaccines are not effective. He's continuously propagated misinformation about vaccines, saying that they cause autism. He's continuously said that vaccines can cause chronic diseases. I mean, this is not what the evidence shows. And this is not what research shows. Research shows that vaccines save millions of lives. And if we look at even just the COVID-19 pandemic, that's very fresh in all of our minds. Research shows that the vaccine saved more than 14 million lives. I mean, that's a huge, huge number. And this is likely an underestimate for how many lives were saved. So it's very concerning and deeply problematic. And this is why many public health officials and many physicians are very worried that, RFK may cause more harm than good.
So they're worried, and I understand the concern, but is it also my understanding that because of his previous comments, one should disregard what we've heard from him today as it relates to vaccines, stating that he's not anti-vaccine?
Well, we have to take the whole body of evidence. It's one thing to say something in front of a Senate confirmation hearing, but it's another thing to talk decades upon decades about how vaccines are ineffective and how vaccines cause major devastating diagnoses that aren't in fact true. And this misinformation will cause problems for the American people. We're talking about safeguarding the health of millions and millions of Americans from an environmental lawyer who is not a scientist, quite frankly. And decisions are supposed to be made based upon evidence. And he did say that he, supports evidence and evidence-based medicines, but that's not what his record shows, unfortunately. Even if you think about fluoride in water, he's talking about removing fluoride from water. And we know through evidence that, fluoride is associated with decrease in oral cavities, it's decrease in tooth decay. And according to the American Dental Association, it decreases tooth decay in 25% of adults and children. So these are problematic things that will have devastating consequences for the American people.
Yeah. Dr. Awan, we have been watching one of two hearings for Robert F. Kennedy Jr., the other scheduled for tomorrow in his confirmation process to head the Department of Health and Human Services. I appreciate you taking the time today and being patient, listening to this testimony. Critical to hear from a medical physician as well, getting your thoughts and your concerns about what could happen with someone like Robert F. Kennedy Jr., given his past stances leading such a large department. We'll take the confirmation hearing going forward for the rest of the day as well as tomorrow.